Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us today. November is Epilepsy Awareness Month, and our guest in studio is returning to speak with us, Dr. Ahmed Abdelmoity, Director of Children's Mercy Hospital's Level 4 Epilepsy Center in Kansas City, Missouri, and he's here today to talk with us about some of the misconceptions surrounding epilepsy and some of the treatment gaps that exist and how some options such as VNS therapy can help improve quality of life. Welcome to the program, Doctor.
Thanks so much. Thank you for having me.
Thank you. You know, when we were here before, we talked a little bit about some of the causes of epilepsy. I personally learned that anybody is a candidate for an epileptic seizure, either maybe one a year or maybe hundreds a day. I learned also that there are many age groups that are affected, from the low end of the spectrum to the first couple of years of life to the high end of the spectrum, you know, in your 70s. We're here today to talk about some of the misconceptions about epilepsy, maybe dispel some of those myths, and talk about some of the treatment options that exist even though there is a treatment gap. Talk about, first of all, what epilepsy is.
So epilepsy is tendency to have more than one unprovoked seizure. After the patient has their first seizure, that's when we kind of keep an eye and look at the whole context. Is that patient has normal development, has had normal exam, imaging is not impressive as far as any abnormality. In that case, we'd continue to watch and observe and see how the patient will continue to do, as opposed to somebody who's had an underlying known etiology, for example, a known genetic disorder that would carry high likelihood of having epilepsy with it, or a known underlying hypoxic ischemic encephalopathy, or a stroke, or sometimes tumors, or a known metabolic disorder that, again, would be more likely to cause seizures. Even after the first seizure, according to the new definition of epilepsy, that which is tendency to have more than one unprovoked seizure, that's when the diagnosis is made, even with one seizure, and the treatment is started.
You know, as I said when I introed you, there was a lot that I learned speaking with you the last time that we were here. Some of the misconceptions that surround epilepsy, they must be many because there are so many different types and causes of epilepsy. What is maybe the one huge misconception that you keep running into when you're talking with your patients or with loved ones of patients about this disorder?
You know, that's a really, really good question, and thank you for bringing this up, because one of the misconceptions, one of the things that actually even stands in the way of the treatment is patients with epilepsy cannot live a normal life, which is a big, huge misconception. A lot of patients with epilepsy, when the proper treatment is picked, and when the patients go through the proper treatment algorithm, patients can lead as normal of a life as possible. And some of the misconceptions, unfortunately, that patients with epilepsy cannot hold a job, cannot live independently, they cannot do a lot of things where other healthy people can do. And I always tell my patients, you have epilepsy, but epilepsy doesn't have you. And it's a really an important thing to highlight and to tell the difference, where when properly treated, and that again brings the importance of when do we choose treatment, how do we set expectations, and how do we measure those expectations against what the patient is doing. So in most patients with epilepsy, some will have some limitations, not necessarily related to their seizure and epilepsy, but related to the underlying etiology of their seizure and epilepsy. But by itself, seizures, when properly handled and properly treated, in most patients, I'm saying all patients, but in most patients, they'll be able to get their academic performance as wished, get their job, and lead a good life. Some of the other misconceptions, unfortunately, about epilepsy is that some patients and some people will treat epilepsy and seizure synonymously, meaning that they will think that seizure is epilepsy and epilepsy is seizure, and that's a huge misconception. Seizure is a part of the epilepsy syndrome. Epilepsy is a big, huge syndrome, including quality of life as part of it. Patients with seizures or with epilepsy, it's not uncommon to have depression, to have migraine headaches, to have anxiety. It's not uncommon to have other mood disorders. So missing that and treating epilepsy as only seizures and paying only attention to the seizures and overlooking those other components of epilepsy, I just did my patient a misfavor or a disfavor by not addressing something that is a big part of epilepsy, and it's actually an important part for the patient themselves. The seizure is a very important part of the epilepsy syndrome, but equally important are those other quality of life measures that are super important to the patient, because that's what gets them up in the morning to do their job or go to school and get their best education.
You use the word proper before treatment several times. Having to use that word implies that there are improper treatments. In your experience and in your opinion, how often is epilepsy misdiagnosed, and what do you think contributes to those misdiagnoses?
Another beautiful question. So epilepsy, there are a lot of epilepsy and seizure mimickers. So to start with, even before we start talking about epilepsy treatment, there are a lot of things that can mimic seizures and would look like seizures. And the importance of proper diagnosis of seizures is very, very super important. So there are sleep disorders that can mimic and look like seizures. There are other behavioral problems that can look like seizures, some tics and other movement disorder that can look like seizures. So number one is making sure that we are actually dealing with seizures and with epilepsy. Second part is inside epilepsy, as we talked last time, there are different types of seizures and different types of epilepsy. So the proper treatment, and typically the first line of treatment for most seizures, for most types of epilepsy, will be a medication. So with different medications available that can address different seizure types and address different epilepsy types, picking the proper class of medication for that patient can really make a big difference in controlling seizures and getting a better quality of life. But the unfortunate reality is that with medications, we can take care of about 2/3 of the patients where their seizures can be well controlled and their seizures can stop. But what about past that point? How do we set that expectation? Can we just go on and say, well, we've done all what we can, or should we move on to non-pharmacological treatment or non-medication treatment? And there are a number of them. As we mentioned last time, there are certain epilepsy surgery, resective surgery, that will identify and target the focus where the seizure is coming from and resect it either surgically or by laser ablation or some sort of ablation to get rid of that focus, or by special type of diet, or by neuromodulation. So talking about a proper treatment, it would be the proper move after a 2 or 3 seizure medications that are properly chosen for that patient, meaning from the right class for that type of seizure, well tolerated, with the patients not having too many side effects, because like we agreed, epilepsy is not just about seizures. I didn't do my patient any favor if I stopped all their seizures, yet I left them with a lot of depression, a lot of kidney problems, a lot of bone problems, and a lot of liver issues. I really didn't do them a favor by just stopping their seizures, but left them with all those other problems. So there's timing, and timing is really a key as we're talking about the proper treatment of seizures and epilepsy. So 2, maybe 3 seizure medications that are properly chosen, past which we know studies and literature and science have shown us that over and over and over, past 3 seizure medications, the chance of getting seizures further better controlled is not going to be that high, and we need to move on to a different treatment modality, any of the ones that we talked about, depending on the patient candidacy and what type of seizure and what type of epilepsy and the workup and so forth. But again, that would be the next proper move. And that's a really an important thing when we're talking to our families and our patients as far as setting expectations. So where the patient should not really settle, should not feel that, you know what, I've done my 2 seizure or 3 seizure medications, I'm still having a seizure every 3 months or every 4 months, that's it. And switching different seizure medications would be the answer, because a lot of times that is not the proper treatment. The proper treatment is to really get out of the box of pharmacological treatment and start doing non-pharmacological treatments for those patients. And that's where, again, level 4 epilepsy centers and other epilepsy centers can help make that distinction for who can go to which direction. Also, part of the proper epilepsy treatment is, like I mentioned, the expectations. What do I put for our patients with epilepsy as expectations? We just agreed that seizures and epilepsy are not the same thing. So putting the expectations for the best quality of life sweet spot and what are the treatments to get me there is really a key thing. One last thing about that proper treatment is timing. One of the things that used to be controversial, which is becoming not controversial anymore, is something called kindling. Kindling, it means that more seizures can bring more seizures. So when I'm waiting on my patient who's having a seizure after a seizure, it can be once every day or even once every 6 months, still, there are some of those evidence that showing that every seizure sets the stage or sets the tone for the next seizure to be more likely to happen. So if I leave that vicious cycle happening without the proper timing of intervention with the next step in treatment, if that is adding the second seizure medication or going to the epilepsy surgery or the neuromodulation, whatever the next step will be according to the patient and their type of epilepsy, that is an added feature, an added component to the proper timing and the proper treatment of epilepsy.
I'm hoping that you'll come back and talk with us about some of the treatment options that are available to improve quality of life for those that are living with epilepsy. Would that be okay, Doctor?
Absolutely. I'd be happy to. I'd love to.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Dr. Ahmed Abdelmoity, Director of Children's Mercy Hospital's Level 4 Epilepsy Center in Kansas City, Missouri. And we've been talking about some of the misconceptions about epilepsy and some of the treatment options that are available to improve quality of life of those who suffer. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.